Hello, everyone, and welcome to this live. Just waiting for my patient to join. In this live, we're going to be talking about osteoarthritis. And we've been talking about specifically about drainage and how drainage is so beneficial for every condition, but in particular for pain conditions, why it's so beneficial. Because pain is a collection of toxicity and acidity in the extracellular matrix. So once we address pain from this perspective, it can be resolved for everyone. So osteoarthritis, any kind of arthritic pain, psoriatic arthritis, chronic pain syndromes, pain from Lyme disease, any pain syndromes can be addressed really effectively with drainage. So I see we have my patient here joining us from hello. Hello, Laura. Hi.
Good
How
morning.
Are you? Good
Very
morning.
well, thank you.
Oh, you look beautiful.
Thank you.
Sorry for the confusion about the time
It's
differences.
okay.
I thought you guys were in an hour behind, but I guess you're 2 hours behind.
Yes.
Okay.
We did not have the change of time with this president that we have. She changed it.
Oh, was it an hour before?
Yeah, but
so
we did not have had the saving time program. Yep.
So now it's 2 hours, but it used to be an hour.
Yes.
Oh, wow. That's crazy. But if you go to Texas, is it an hour?
I'm not sure. I think so. Like if you go closer to the border, I think it's also the same time right now. Yes, I know Cancun is different though. It has different time.
Cancun's only an hour?
Yes.
Wow.
Yeah, a bit confusing.
So thank you for deciding to join. I wanted to do a live with you and talk to you because your case has been so interesting. So, I tell people drainage works for everybody in all conditions, but you were kind of like a very textbook case. You kind of responded exactly the way I wanted you to respond, and you responded the way that drainage is ideally supposed to respond so effectively. So it was really cool to watch kind of this textbook case. Over the last 2 years, we've kind of been working together, and you've done an amazing job, and really, you're an amazing patient. You've listened to everything I said.
I've been an amazing patient because I have an amazing doctor.
Oh, thank you. So let's start from the beginning. Why don't you talk to me a little bit about what your condition was when you were diagnosed, kind of what you were experiencing in your body at that time. Okay. And this was about 2 years ago. Yes. This kind of started. Mm-hmm. Just give us an idea of kind of where you started.
Okay, so I first started beginning of 2023. I started to feel different in my hands, like pain, but I was playing guitar. So I was like, oh, it's because the movements I'm doing in the guitar. And it continued to gain strength, my pain. So I'm like, I don't think so. I had to quit because I was getting stuck. Mm-hmm. And then as it was like by 3 months in guitar, and I said, okay, that's it, because of my hands. And in mid 2023, things got very, very bad. Like my pain was up to 10 level, and I had to stop doing things because my pain. And that's when I had to seek for help.
Mm-hmm. And prior to that, you hadn't experienced any kind of pain like this before? This is the first time in your life you really kind of had this pain?
Yes.
Okay.
In my hands, yes. Mm-hmm.
And so, okay, so you went to the doctor. What did they say? What did they diagnose you with? What did they say?
So I went to the doctor, and they they did blood tests on me to see if it was not kind of arthritis,
Mm-hmm.
but I cannot remember specifically what kind they were looking
Yeah.
for. And they did X-ray, and it turned out that I had osteoarthritis. Sorry.
Mm-hmm. Yeah.
Every little joint in my fingers was hurting, and in my right hand I felt more deterioration. Like you can see visible signs of my bones, just they were not well,
Mm-hmm.
especially in my right thumb. It was very like crooked and swallowed.
Was it the all the joints, so the middle and then the yeah, the whole hand?
The whole, yes, every single joint.
Mm-hmm.
Yes.
Wow. Okay. And what did the doctors suggest at that time? What they
Okay, so I was like, okay, so what is my treatment? And she was like, there's no treatment. I'm like, what? What do you mean? Yes, well, this kind of arthritis, it will just get worse with time, and the only thing you can do is take painkillers. I'm like, what do you mean? There has to be something to do, a treatment, massage, I don't know, some therapy.
Mm-hmm.
No, there's nothing to do. Like, I left the doctor, and I was like, I refused. I refused to hear this option that there's nothing to do.
Yeah. Well, conventionally there is nothing to do other than to manage the pain. They really don't have the tools to kind of do anything about it.
Yeah, I mean,
So, okay. So that was, you said 2023, and then
mid 2023. Yes.
I remember we spoke. How long had you been dealing with the pain when you kind of approached me and told me your story about what was going on? What was headed?
I think when we
How long had you
first
had the?
started to talk,
Yeah.
it was August 2023, and I started from low to high and in January, February 2023, and it's 6 months, no, eight months.
Was anything working? Where if you took like any pain medications, was there anything working that they
Well,
recommended with steroids or?
it was, I had to take anti-inflammatory medicine and painkillers. It worked more or less. I was doing my tasks with maybe less pain, but I just remember being in a lot of pain. Like
Mm-hmm.
unbuckling my daughter from her car seat it became impossible. I couldn't do it. I needed help to do that type of movement.
Even with anti-inflammatories
Yes.
and the medications
Yes.
you were on?
Yes. It lowered a little bit, yes, but
It was still always there.
it was there, and strong
Mm-hmm.
pain. Yes.
Had you tried anything natural? Had you tried at that point any
Well,
turmeric or anything?
I started with acupuncture. Yes.
Was
But
that
that's
helpful?
it. I think it did help a little bit. Yes.
Mm-hmm.
I think more than the painkillers, actually.
Yeah.
They put needles, especially on my right thumb, that it was very bad. And I think it helped a bit, yes.
Okay. So then, you approached me, and I said, well, we're gonna work on this. We're gonna figure it out. And you were very determined, and you were, said we'll start a course of drainage. You were very motivated
Yes.
to work with me, which I love to see. Did you have any fears? Were you worried? What were you thinking when we first kind of got started?
So I will not call fear, because you guided me very well through the process, and you explained what might feel, sorry. And the only worry that I had was that I needed to change more or less my the time that I take my food. Like in the morning,
Mm-hmm.
I always have eggs, and you recommended, no, first start without protein, because it helps better process the drops. So adjusting to my new food
Mm-hmm.
time.
Yeah, well, you only need like take it before food. You can take it and you can wait like 15-20 minutes. But yeah.
And we started with Herbert, this one.
Yes, yes. You still that's like gold. You still have a package. No, you can't get that
No,
anymore.
it's
Oh,
empty. It's empty. I have it just for a record because it helped me a lot. So I
yeah.
keep it. So the flavor of Harvard for me, it was
Wait.
very
Yeah.
hard.
So we started with Havard, which is a German drainage company,
Hmm.
and that was available on full script, and you ordered it to Mexico
Yes.
or to Texas, and you picked it up.
Hmm.
And tell me about your experience with the drops initially, with the flavor and everything, and how you got started.
Okay, so when I first tasted the first shot of drops, because with the Harvard, the drops you need to take separately. So I had little shots, and I used to put a little bit of water because it was very, very intense, the flavor without the water. And I was like, oh my God, no, I'm not going to be able to do this. The flavor is just, I cannot take
So
it. How am I going to do
so
this?
dramatic, so dramatic.
Very. And then the second shot, I'm like, no, 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 no. Oh, but whatever. I got used to the flavor with the time. And I had a lot of symptoms. I had a lot of headaches.
Yeah, I
I
remember
was
we
very
started.
tired.
I think we started with 5 drops, right? Or did we start with
Yes. No. Yes. 5. And
5?
then,
We started building, yeah.
yes.
And then at what point um, did you start having kind of these detox symptoms? A little bit more headache, a little bit more achy.
Within the week, I was already feeling headaches and very
Yeah,
tired.
yeah,
And I used to feel like my body would shut down, like I need to sleep.
yeah,
Not even rest, not even, you know what, okay, I'm not going to do anything, read a book. No, sleep. I needed to sleep.
yeah, yeah,
Yes.
yeah. Your body was healing. You have such a great textbook responses. So okay, so I think we took you down maybe to 1 drop, or maybe I think we started at 10 and we went down to 5.
Maybe, maybe, yes.
Um, because I usually don't start people with 5 right away. Usually I say 10. You know, if you're a healthy person, generally what I'd start every year when I do drainage, I start with 20 drops.
Hmm.
But if you had never done it before and you were dealing with pain like this, then I think I probably started you at 10. And then maybe we went up slowly and then you were having symptoms and I dropped you down to 5. And then we stayed at 5 for a little bit. And then when we went
I,
down, go ahead.
I believe like every week we used to get more amount until I
Yeah,
got to 20.
yeah.
I
And
think
then
I did 30.
you were able to get there within like about a month, right? About after a month, we were at
Yes.
the higher end. And
Hmm.
then how long were you experiencing those symptoms of like achiness, fatigue, a little bit more pain? How long did that last?
So I think like the first 2 weeks, couple of weeks were very intense headaches. And then every week my body was shut down. That time a week, my body would need to rest. Like I felt that same thing that I felt at the beginning, like my body needs to sleep. So I understood because I spoke to you about it and you said, yeah, your body needs to recover from what you're doing to it. So okay, it's time to sleep right now.
Yeah.
And at
And you were
1 month,
also taking the minerals, right? You were
oh
taking
yeah, yeah,
the
the
minerals.
C minerals.
Mm-hmm.
Hmm.
The
Yes,
quinton, yeah.
very
And
good
then
ones.
you had you changed your diet at all? Where I made some recommendations around diet. I mean, your diet was pretty clean. You didn't have a
Yeah,
lot of issues with diet. Yeah.
no, I was fine. I used to have more red meat, but I
Yeah.
lowered to twice a week, as you recommended.
Yeah. Good.
But
Good.
within the month, I already felt change. I already felt change in my pain.
Mm-hmm.
It
So
it
from
dropped.
like a 10 to like
7 or even 5 in the first in a month.
yeah,
Yes,
great.
yes, it was
And then
amazing, and
we
we
continue.
continued.
Yeah,
Yes. Hmm.
we continued for another 2 months,
Yes.
and at certain point I added in some pleomorphic remedies. I think with second month we added in some pleomorphic remedies, some bacterial and viral remedies, which just generally help to lower inflammation and to address any underlying bacterial or viral infections.
Yes.
Um, you didn't really notice like any differences when we added those on, like you weren't any, it was just kind of.
No, I think it just helped quicker to recover from my joints.
Yeah.
Because it was specific for joints, those remedies that you
I'm sorry, we did add in from Germany, we ordered the remedy from the specific for the joints too. That's right. Another drainage remedy that's just targeted. So the drainage remedies we started on are general for the drainage pipeline for the liver, the kidneys, lymphatic system, the gut. Those are generally lowering toxic level, but then we had the specific remedy that was targeting the joints. That we added, I think, in month 2 or 3. So you just continue to improve, and
I think by the second month when I finished, I said, I told you, I think I'm fine, and you said no, we need to keep going one more because it was very severe what I had, so we kept going one more.
Yes, I remember. Yeah, you said that your pain was down to it's like a 1 or 2, and I said no, we're gonna get you to 110%.
Yes.
So we did another round at that point. So we did total of three months.
Yes.
And so and then at the end of the 3 months, where was your pain? Where were you at?
0. I did not have any pain. Amazing.
You're an amazing patient. Yeah, perfect. You did exactly what you were supposed to do, and you responded exactly how you were supposed to respond. Your body cleared the toxicity, lowered the acidity, and the body responded on its own. The immune system responded on its own. The immune system came back online. Inflammation generally is going to start lowered, and that's amazing. So when you also mentioned, talk a little bit. You didn't mention this initially, but you had some other pains in your body that you also then told me, oh wow, this resolved. I didn't even mention this to you. This other pain resolved.
Yes.
Where were you experiencing that pain?
So back in 2021, I had to undergo abdominal surgery, and I don't know how, but my left hip got injured in that surgery. At the beginning, when I was recovering from the surgery, I said, okay, I feel weird in my hip, but I'm recovering, so it's normal. Within the month that I already recovered a bit, I said, no, there's something wrong. And I went to do x-rays, and I started treatment with very hard painkillers because I was feeling a lot of pain. I could not walk. My leg was stiff.
This is 2020, you said, or
2021? Yes. So with the help of painkillers and also anti-inflammatory medicine, I was able to walk and do everything normal, but the pain was there. I had pain. I was able to move now, but I had pain. And when it happened with my hands, it was already 2 years. It passed 2 years. I still had my pain. Certain movements I could not do. Actually, I thought I lost already my flexibility because I'm very flexible. And movements in yoga I could not do. And I said, okay, that's it. I'm going to be like this. So I had the pain in my hands. I forgot a little bit about my hip. I concentrated on getting better in my hands because it's very important. And one day, after already the treatment, I like going through the 3rd month, I wake up and I was like, wait a second, where's my pain in my hip? I don't feel it anymore. I'm like, oh my God. Wow. So I already took my phone and I called you and said, you know what happened? I don't have pain. I don't have pain.
Yeah.
Took the pain away. I mean, it's unbelievable.
Well, it's amazing when you start, trusting the body and working in the foundations and clearing toxicity, helping support the body. The body is very intelligent. And the body is going to help self-manage and self-regulate on its own. So, it's almost you don't even need to know the symptoms because I know it's going to work. If we do it, everything's going to improve. So it doesn't even really matter what, we use the symptoms to track to see, okay, are we moving in the right direction? But it really doesn't even matter because, everyone's going to benefit. So you had an amazing response. And then, how long we stopped? I think we started just as a maintenance. I think I gave you glutathione to start doing.
Mm-hmm.
Oral glutathione just as a maintenance kind of detox for the long term,
Mm-hmm.
which is really good. How long were you kind of pain free before the symptoms started kind of creeping back again?
About 10 months. 10
Okay.
months, I started to feel a bit of like I was getting stuck in my hand, but pain level, I would say 2. And
Yeah.
we right away started with another second round to
Yeah.
not go higher in pain.
Yeah.
And 1 month, and it was perfect again.
Yeah, and I think at that time we still had Hevert, so we did a month of Hevert.
Yes.
It was 10 months later we did a month of Hevert and the minerals, and after a month, from 2 back to 0, and then how long after that? About probably another 10 months, right?
Yes. Yeah.
So then this was this last time.
Yes. So now we're with Guna.
Right. So we're no longer, Hevert's no longer available in the US, so we switched to Guna, which is the Italian company. Exactly similar remedies, drainage remedies for liver, kidney, lymphatic system, and gut. A little different flavor. You kind of mentioned the flavor is a little bit more.
It makes me happy.
Yeah, a little bit more like tequila. Because they're all alcohol based. But I think that the Hevert is a little bit more herbal. It tastes a little bit more like you're drinking plants or something.
Very strange flavor.
Yeah.
Yes.
Whereas,
yes, with Guna, I was like, oh my God, what's going to happen with the flavor? And I took it. I'm like, oh my God, this is so delicious. It's like having a shot of tequila, and with a good cost, beautiful.
Yeah. You mentioned, you noticed differences in how you felt with Guna versus Hevert. Talk a little bit about like how you kind of experienced them differently.
Okay. So, well, first of all, with Guna, you can mix everything in one shot. You don't have to take separately. And you mentioned you could add some water, but I don't, because I really love the flavor. So I put everything in one shot and just take it.
Yeah.
This time I felt it took a little bit longer to feel effects, positive effects. I started with headaches, very tired at the beginning, but we started with 20 drops right away.
Yeah.
So you said, you know what? No, stop. We're going to go down to 10 and then maybe work yourself in. But we stayed at 10 the whole treatment right now.
I think you also mentioned, though, that you had more energy, or you felt more energy.
Oh, yes. No, wait a second. So the first couple of months, I was very tired, headaches. You lowered the dose, and all of a sudden, explosion of energy. Like I was like, where is this coming from?
Well, this was amazing. It was like a 2 weeks after we started, right? It wasn't, because you only been doing it for a month. It was like 2 weeks later. We went from 20, we then went down to 10, and you noticed more energy.
Well, actually, the first week, was 10. No, sorry, 20. And that's within that week, we lowered because my symptoms were very strong.
Yeah.
So second week started with 10. My headaches came down, and then the energy came. I mean, I could not believe the energy I had. I felt really good.
And you didn't have that with Hevert? I don't remember you saying that about Hevert.
No, not at all.
That's cool. Yeah, I noticed similar with Guna. Like I was taking 20 drops and I felt a lot of fatigue. And I remember I texted you and you were like, well, why don't you lower the dose? And I was like, good idea.
That's what my doctor recommended.
I just completely forgot. I was like, I'm just going to stop it out. And you're like, you just lower the dose. So I was like, oh, good idea. Great. So then after about a month, you were back down to 0 again.
Yes.
But then, I recommend it. Let's do another month.
Yes. So I just got my package. This time took a little bit longer to get because I had some trouble with my PO box, and I just got them here. I have them here.
Awesome.
Yes.
Yeah. So let's do another month. And maybe start at 10 drops and see how you do, and then you can add a drop a day, and maybe go up and see how you're doing. But at this point, if you have no pain, you're not going to probably see a lot of detox step reactions. Someone joined late and they asked what happened to your hand. You said she was diagnosed with osteoarthritis in both hands.
Yes.
And then, so then since then you've gone back to your doctor and
You,
said you were
you know
painful.
what? I don't even want to see her because I got so mad with her response of there's nothing to do. But
Well,
I wish I had I needed to go and tell her, listen, this happened to me.
you know, you shouldn't be mad. It's they don't know. They don't have the tools and they're not aware. It's like, are you gonna be mad at a blind person for
No,
knocking into a door,
no, no, no.
they just don't have the tools, they don't have the experience with it. And so um that's what I'm excited about. I love teaching, and I love teaching doctors in particular, because if I teach a doctor in Mexico, they're going to be able to treat everybody in your neighborhood and not relying on me treating one by one. So
Yeah.
my passion is right now teaching and promoting to doctors, any healthcare professional, wellness professional who's interested in learning true medicine, true healing, that can really address the root causes and foundation. So anything else you wanted to add? Thank you so much
Well, yes,
for coming.
actually, doing this type of treatment changed my life. Like
Oh,
I would
oh,
recommend 100% for somebody to try. Like if they're afraid, there's nothing to be afraid. It's the natural medicine. It's only gonna do good to your body. Like if you say no, I don't know, maybe it's not gonna help. Okay, just take it. It will help.
yeah.
It will help.
I think, Americans in particular are very afraid of experiencing detox symptoms and reactions. If you tell somebody, oh, well, you may feel a little bit worse a little bit when we first start, you may feel a bit more fatigue. Oh, no, I can't. I'm already fatigued. I'm already in a lot of pain. I can't do it. I can't. No, just give me something that's going to cut the pain. And I've seen that a lot with Americans. American patients are very afraid. So, you live in Mexico, you have a little bit more of a maybe European mindset to trusting the process and trusting the healing process. Whereas Americans, we're so used to medications and pharmaceuticals, and we're so used to just give me something to kill the pain. I'll take it. I don't want to deal with anything else. The mentality of I find it can be very difficult for Americans.
With this guna that we started this time, it happened to me that I felt more pain. I don't know if you remember. I told you, like, wait, my pain went up very fast. I was supposed to drop, and you explain exactly that it's different process because it's different also detox than the Havert, and it might happen.
Yeah, I mean, it's interesting to see the different companies. I've worked with Havert, I've worked with Saluna, I've worked with all of them, and I see how patients react differently, respond differently. It's interesting. Just different remedies are different, but in general, these are good signs that the body's mobilizing. That the body's moving, the body starts to push. And when the body starts to push, it can feel uncomfortable. It can have this kind of inflammatory reaction, this temporary inflammation, as the body starts digesting all the toxicities, especially in the joints. The joints are key areas the body hides things. The body likes to hide toxicity in the joints because they're big spaces. So it's like, let's just put it there. It's like you have all this garbage you put in your garage. It's like, put it in the garage. We don't want to deal with the garbage. And then these remedies come along and it's okay, let's support the body's removing the garbage. We're getting the garbage out. We're not going to block the pain with a medication that just blocks the signal, because pain is a signal. It's signaling that something's wrong, something's happening. There's too much garbage in these joints, so the signal is pain. We're not blocking that pain signal, we're removing the garbage. We're removing the toxicity, we're removing the acidity. Also, we started this time off. I recommended starting taking a little bit of baking soda. And baking soda, we did a little baking soda. Baking soda is generally lowering acidity. So it's not addressing the toxicity, it's not pulling toxins out, but it's lowering the acidity. And there are really great studies on just even baking soda helping with pain, because it's helping to lower the acidity, and the spaces when they're acidic, they're going to be more painful. So I actually started doing that more adding in the baking soda. I think it's a really great add-in for drainage. And a lot of the big doctors in the world recommend, Dr. Rao, kind of the foundational doctor for European biological medicine, uses a lot of sodium bicarb as an additional support to lower acidity in the body. So yeah, anyways, thank you so much for coming
We could
on.
be talking forever about
yeah,
this.
there's a lot to say, a lot to talk about, and I'm going to
Yes.
be talking more about it. I'm going to be doing more videos, promoting this type of medicine, this type of philosophy to practitioners and the people to heal the world.
Make it a better place. Well, I hope a lot of doctors start to follow your idea, because it's really amazing what these products can do to your body. And you make great explanations, and you're a great doctor, the best doctor.
Oh, Laura, thank you so much. All right, so we will be in touch, and thank you again so much for doing this.
I'm glad
and
to help.
I will see you later.
Yes.
Bye.
Bye.